see that?
Yeah, I did. What up, Dave? How are you? How are you doing?
I'm doing fine. You know, I'm still here in San Cristobal, Chiapas, Mexico. Still here since the last time we talked. So
Just about a minute ago.
I haven't left. So I'm gonna stay here for at least another hour.
Then where are you headed?
You know, I'm not quite sure. I might go explore some lagoons, some waterfalls close here. There's some Spanish towns here that have got some really cool things to go see, some ruins and stuff. So there's just so much to do here. So we'll see. I'm kind of just going day by day, giving myself permission to not have a lot to do and just do what feels inspiring that day. Just kind of follow my nose. I really enjoy traveling like that sometimes, you know.
Yeah.
So, yeah.
I love that.
Where are you?
I'm in Waterloo in my office.
All right.
Hanging out.
Great. So you got a good topic for us today?
I do. So I'd love to discuss and open the floor to a conversation about how our emotions can affect our perception of pain and intensity of pain. In my practice, I have our philosophy of care is that there are 5 core requirements for health. Your spine and nervous system, because your nervous system controls everything. And it's really important that your nervous system functions at peak velocity. We also have sleep, nutrition, movement, and self-esteem and stress coping strategies. And that's the big, mental health, emotional component. And what I'm finding is people can have a hard time understanding how emotions affect their pain and how it can really affect their perception of what's going on in their body. And so I'd love to dive deep into that to provide some real examples for people so they can begin to understand that when they start to have self-mastery over their emotions, it actually really greatly impacts their health and their pain perception.
Such a great topic. Because in my practice I was in practice 29 years and I saw this a lot. And, to be honest, the majority of the people that come in with some pretty good physical pain, there is some emotional components to it. But the majority of the patients don't want to go there, or they don't understand that relationship. So I found that when you first ask them about it and try to make that link, they'll usually, oh, no, I have no stress. I have, I'm fine. I'm perfectly healthy and I have no anxiety, stress, or anything. I don't get stressed.
Emotions.
Yeah, I'm fine. And we know that they're, usually unaware that that's not true. And so I would always reframe that by just saying, hey, in my experience, I've worked with a lot of people who've had the same condition. And I found that there was a component, there was a stress component to it. And because of you and I have a knowledge of how the body stores emotions in certain areas of the body, you can kind of pinpoint, if there's pain in the low back, well, it's likely they're having some stress around finances or stability. If there's pain in the hip or knee, well, they're probably having stress around moving forward or something. Or if they're having stress with their colon or constipation, they're probably having some stress or anxiety or letting go. So, we have the knowledge of that. So I like to reframe it with people and say, hey, in my experience, people that have similar issues, they tend to have stress around letting go of things, or they have something, if you got pain in your tailbone or in your bottom, then maybe there's something in your life that you are perceiving as a pain in the butt. So, and just open that up. And then I find that then they can relax and then open up to telling you what's going on. Because, it's a tricky subject for people, their stress levels, and they like to deny before opening up, right? So what do you experience?
And I get that too, because emotions, especially if you don't have tools to understand your emotions and help balance your emotions, it can be a topic where it's like, I don't want to dive into that. And I also want to believe that that's not a part of it, because maybe it's too painful or too challenging to even admit that there is something going on there. right? And
Yeah.
maybe some fears are coming up around that. So one of the examples that just comes to my mind to help kind of bring that link of the mind and the body connection, and specifically with pain, is phantom limb pain. You know, someone has an experience or event, maybe they lose their arm, right? And after that, when they don't have that physical limb present, they're experiencing pain in their arm on that side that it was lost, as if it's physically there. So then you begin to wonder, where is the pain coming from? If they don't have the limb there, yet they're still experiencing the pain, that's got to maybe hint that there's something in the brain, some connection in the brain that's triggering that pain. And so then you begin to ask, well, why and when does it get triggered, right? And so this is where I'm beginning to link it to the emotional connection. Well, maybe there's something that happened in the past that was painful that can trigger a connection in your brain, what we call a synapse, that then gets the body into fight or flight. And then you go in this protective mode in order, and that's what pain is. It's the body, you know, giving you a signal, and in that fear state, or in that amygdala state, that emotional reactive center, to let you know there's something going on. And so when people come into the clinic with back pain, and I ask them, you know, well, what's going on in your life? Do you got a lot of stressors, things like that? It's beginning to ask the questions of how may your emotions be increasing your pain sensitivity, and is there a connection in your brain that's been triggered by a past hurt that's causing this to surface?
I totally agree. I saw that so much in practice, and you can balance out the physiology chemically and physically, you know, with chiropractic and nutrition, but if the emotion's not balanced, it trumps everything. And so I think it's just a really important key to dive into those perceptions that clients have or patients have, that we know is an underlying factor in having the feedback of pain show up. And so, you know, when you can be open up to exploring deeper meanings behind your pain and the feedback of pain, and I think it's important to, I always like to teach clients and patients that it's just feedback, you know, and the worst thing to do would be take a pill or do something to just numb it so you don't learn anything. And so to see it as feedback, and to be able to dive in with us to help identify the underlying causes of the pain and why it's showing up, because if it's showing up, it's something to be addressed, right? So it's something to dive into and try to learn. Otherwise, it's just going to come back again. And the way the body works, obviously, you've probably seen this, when you ignore the small pains, you just get a bigger pain, and you ignore the big pain, you get a gigantic pain. And that's when you develop into more serious diseases and which are more serious feedbacks, right? So.
Yeah, getting you to bring it to your attention or awareness. And
wake up calls. You know, pain is a wake up call for you that something is out of balance, chemically, physically, emotionally. And, you know, if you ignore your wake up call, it's just going to get worse. And so it's just a great thing to have on your team, someone who can analyze and address pain and other feedback so you can get your body healed.
Yeah. One example that's just popping to mind now that I used to do, this is not with my body, but with my car. I remember when I was in chiropractic college, I had a car, and it was an older car. And I remember anytime I would drive from Toronto to London to visit my family, I'd start to get this like rattling sensation or rattling noise in the car. Yeah. And, you know, it really scared me. And so my reaction to that at that point in time was, well, let's just turn up the radio. And now I don't hear it. And so I was just turn up the radio, and it's like, problem solved. There's no problem anymore. And that's analogous to, you know, taking something to numb what you're actually experiencing or pain. And you could do this through, you know, alcohol, food, medication. There's different ways that people try to dim the pain or reduce the sensation. But the challenge with that is I actually had to get a car piece replaced. Otherwise, and I remember thinking like, okay, wherever I'm going, I hope I know someone on the way, so that if I get stuck on the side of the road, at least I can call a friend to say, hey, I'm in trouble, right? So we are those people that if there is that rattling noise in your car, to use the analogy, is instead of turning up the volume to kind of dissipate what's actually going on, is we are those people that have the tools to actually integrate what's going on and be the diagnostic to figure out what's going on in the car, what needs to be fixed or changed in order to make sure that you get from destination A to B.
Yeah. And one of the things I found with people that came in with pain was not only they had pain, but they also had anxiety about having pain. And so I always like to ask the question, well, let's look at what the pain, what is it teaching you? How is it serving you right now? I know you don't want it. That's cool. We're going to get rid of it, but let's learn from it so we can go there and start seeing some lessons. That takes the anxiety away from having the pain. So now you can actually tackle it even more and not have these feedbacks of anxiety and pain, So I think it's important to realize that your body is so intelligent, and it's going to give us feedback, and that's what it's meant to do. It's doing its job. And so pay attention to it and learn from it so you can reach your health goals and then go the next thing that's going to come, because you're going to continue to track, supports and challenges and pains and pleasures. So, when you can learn how to navigate your life through ups and downs, ebbs and flows, then you have more self-mastery. And that's kind of what I know we're both here to do, is to help people master their lives by learning how to manage their emotions more effectively and navigate these challenges that they have. Yeah,
I love that. So well said. And so if someone wants to reach out to you, Dave, where can they find you?
I think they can go to drdavetuck.com. It's probably the best way. It's got everything on there. You can access all my social media links and find out where I am and get in touch. And what about you? How do we find you?
I'm on LinkedIn if you'd love to know more about what I do with my high performance coaching. You want some emotional regulation tools, connect with me on LinkedIn or Instagram. I also have a website, empowerchirokw.com. So any one of those is a great place to reach out.
Perfect. Well, this is a great topic. I always love, this is what we've done all of our, I've done this for 29 years now, chiropractic and mind body work. So it's a great topic. And I think it's going to be an important topic from here on out for the rest of eternity, health and wellness. So
absolutely.
So thank you for holding space.
Absolutely. It's so great to see you, and looking forward
to seeing you.
Our next conversation.
All right. Have a good rest of your day and week.
You too.